Hello. I am so sorry I am late. This is my norm, right? Always happening. Let's wait for Instagram to catch up with us. Hello, Instagram. Hello, ladies. How are you guys today? Hello. Okay, Instagram's always lagging. Tell me who you are. Tell me where you are watching from. Let's see. Hi. Hi, Debbie and Yimmy. Hello. Hello, Devin. Hello, everyone. Tell me who you are. Tell me how far along you are. Tell me where you're watching from. If you're on YouTube or you're on Instagram. Hello, hello. We're going to be talking about membrane sweeps. This background picture is cracking me up. Are you kidding right now? It's so funny. Oh my God. This is cracking me up. Okay. I am going to pull up my notes. Let's get my notes out. Let's see. All right. Start the podcast recording because y'all know you're going to be part of the podcast with me. You know this. All right, let's see who all is here. Say hello. Who's watching from YouTube? Who's watching from Instagram? I'm going to pull up so I can see the chat on Instagram. Let's see if I can see it. All right. Yep, there we go. So I'm going to turn down the volume so I can see you guys and watch what you're saying. Not seeing a lot. Okay, let me see. How far along are you? And if you guys see the share video, do me a huge favor and share it with a pregnant friend. I will love you so much. Make sure that you tap the heart right now. Tap the heart so I know you guys are alive. Bliss is 42 days. Oh my God, I'm so proud of you. What? I am so proud of you, girl. You are amazing. So we're going to be talking about membrane sweeps, and we're going to talk about like what it is, when you should have them, and then I'm going to break down some things about cervical exams. And I even have some props here, you guys. Oh, thank you, Jenny. Jenny is one of my students. Oh, I think maybe I've popped this thing. It's one of those finger things, but I'm going to use it to demonstrate. I've got some cervical dilation demonstrations here too. So if you're listening to this later or while you're driving, then go to YouTube and check out the live video so you can see all the props. 37 weeks and 2 days. Ashley is 36 weeks, their first time mom. Yes, I will be posting it on YouTube. We'll try to get it up on Instagram. Sometimes it doesn't work, but you can definitely go to the Labor Nurse Mama YouTube channel and watch it. I'll post it to my stories later. Okay, let's see. Claire is 40 weeks today. Roxy is 33 weeks and 1 day. Bliss is 40 weeks and 2 days. Shacklone, I'm not sure. Shacklow, she's 34 weeks and 5 days. Oh, wow. So someone said that they're suggesting one next week when she's 39 weeks. So we're going to talk about that. So let's go ahead and get started. Oh, Kat, my heart is with you, girl, but I am celebrating this rainbow with you. I love it. We've got India in the house. Hello, everybody. We've got Jade. Her due date is today. Perfect day to have a membrane sweep. And then we've got Big Aretha. I think 39 weeks. And Brilo is 39 weeks and 4 days. She had a sweep on Monday. And Sunama, 27 weeks. And then someone said she had a sweep yesterday or something and had her baby girl now. So I'm going to screenshot that because that makes me excited. Okay, you guys, let's go ahead and get started. This dress is supposed to be off the shoulders and it's literally like riding up. So we're going to be struggling with that. All right. So I don't know if anyone's over here on YouTube. Hello, YouTube. Hi, hi. Hopefully you can see us. All right. Let's go ahead and get started. So we're going to talk about membrane sweeps. What exactly is a membrane sweep. And how does it work, right? So, first things first, we'll talk about what it is. A membrane sweep, also called a stretch and sweep, is a procedure that your provider might offer you towards the end of your pregnancy. Now, not all providers are fans of membrane sweeps. Some of them don't offer it. You may have to ask. And some of them have some different rules. Okay. So we're going to talk about those. Sorry, my child is messaging me. Always happens. Okay. So the membrane sweep, basically what it is they do it during a cervical exam. You have to be dilated. That's the big thing. You have to be dilated. Okay. Because to do a sweep, and this is my mock uterus and then my cervix. So I'm going to put it right up to the camera. To do a sweep, they have to be able to get a finger inside your cervix like that. Let me show you another one that might be a little better. So I'm going to show you a closed cervix. So this is a cervix that is closed. You can see there's no way we're going to be able to do a sweep because we can't get our finger inside of that. It has to be open a tiny, tiny bit. So here's one that's like 1 centimeter dilated, right? They have to be able to get a finger in. But as long as it's a fingertip that we can get in, usually they can do it. But you see that they have to be able to get inside your cervix. So what happens is the inside of your cervix, you've got your membrane, your bag of water, right? The inside, you've got the membrane is attached to the cervix. And what they do is they actually use their fingers to gently separate the membranes of the amniotic sac from your cervix. So this is why I got this guy here. You can see we can kind of open it up, right? So let's say that I'm going to put this inside of this little cervix here, right? Let's see. You've got it in here. And then they just come in and they go between the wall of the cervix and the amniotic sac and they just go around and they're going to use their fingers to gently separate the membranes of the amniotic sac from your cervix. And this process, what it does is it's intended to help your body say, oh, okay, it's going to send signals to your pituitary gland and release hormones called prostaglandins, which can actually encourage labor to start naturally, right? It also, when it releases those things, including oxytocin, the oxytocin will, cause some contractions, which will push the baby's head down further onto the cervix, which actually propels the whole cycle. It is considered less invasive option compared to a medical induction, but technically it is a form of inducing, right? Getting labor started, but it can encourage labor to start naturally. My doulas and I are actually fans of a membrane sweep. Now, remember, if you just hopped on, tell us who you are, tell us how far along you are, tap the heart and share this live with someone who is pregnant. Make sure you're following as well, because I do a live every week, usually on Thursday. However, the last two Thursdays have been chaotic. Okay, so it's basically a natural-ish labor induction starter. It's important to note, though, that it's usually not effective on the first try. Unless you're past 40 weeks, that ups your chance of the effectiveness. So that is what a membrane sweep is. So let's go to the next slide if I can figure it out. Not sure why it's not letting me. Hold on. All right, let's go to the next one. So we've kind of talked about what it looks like, but let's talk about when is it actually performed. So you can see that a membrane sweep is considered a form of induction. It's just a lot less invasive. So most often they will suggest a membrane sweep. Now remember, I'm saying suggestion because you guys have every right to say no. You don't have to do it. But usually they're going to suggest your membrane sweep between the weeks of 39 and 41 weeks pregnant, up to 42 weeks, especially if you're going, getting closer to due date and there's not any signs, or past your due date. But remember, I said you have to be dilated or they can't do it. So hello to my 4 months pregnant and Carly. I'll do some questions at the end. And Claire said she got a sweep 2 days ago and was 3 centimeters, lost some mucus plug, but no labor on her third baby. So here's what we recommend. We recommend to our students that they do it 3 times. 3 times is usually the most effective. And I know that's like, golly, that's a lot. But you know what? It's a great way to avoid an induction if you're not patient. Now, if you're a patient girl, you don't need to do any of this. You can wait on your body. So it's just remember that it should only be done with your informed consent. There's no sneakadoodles here where they're doing it without talking to you, because that is legit not okay. They should not be sneaking a membrane sweep at all. And I know that they do. They do that. So if you're feeling uncertain or you have any questions, I always recommend that you speak up. Speak up. They usually don't do much before 40 weeks or so, unless your body's already primed and ready to go. So I personally don't recommend to my students, and inside of our labor bat signal, which is our, an add-on that our students can add on for $49, where they get a direct chat with me and my doula from 36 weeks to 8 weeks post, or 6 weeks postpartum, 8 weeks postpartum, 8 weeks postpartum. It's an insane deal for just $49, but you have to be one of my students. And the reason is because we walk them through all of this, and we walk them through, when is it appropriate? When is it not? When is it out of convenience? So that you can be the birth queen. Because when you join my community, you become a birth queen, period. That's your identity. Okay, so one thing I will talk about is that some providers will not do a membrane sweep if you're GBS positive, you're group B strep positive. So that doesn't automatically mean they won't, because a lot of them will. But the concern that the provider might have is that it can potentially introduce the bacteria into the cervix of the uterus. So they're going to weigh the risk. But if you are being treated with antibiotics, it's really minimal risk. So I personally, if I were GBS positive, I would do a sweep if I felt like it. Now, again, let's talk about let me go on a little bit to the next slide. So here's what to expect after the membrane sweep. After the membrane sweep, what you might experience is some cramping, some spotting. You might see an increase in the contractions, and those are all just signs that your body is responding to the procedure. Sometimes all it will do is get you to release your mucus plug, which really isn't a sign of labor. But if labor doesn't start, don't worry. It's not uncommon that it's still going to take time, and you probably will need up to 3 membrane sweeps. So I always say schedule them, have this conversation with your provider, be insistent. You're paying for the visits, girl. You can do it. And remember that membrane sweeps are mostly considered safe. But your peace of mind is the most important thing. So if you're like, I ain't up for this, don't do it. You don't have to at all. So I added some pictures in here for you guys. Let me pop it up, and I'm going to make me a lot smaller so you guys can see it. And if you're watching on Instagram or you're listening on the podcast, just head to YouTube and watch the full video so you can see these graphics. Oh, this is not a membrane sweep. I am so sorry. Let me grab the right one. Hold on. I don't know what I did here. I've got the wrong one on here. Funny story though, you guys. What's really, really funny about this is I got in trouble. I got to find the right one. Do I even have it anymore? Yep, there we go. Let me pull up the right one, and we'll get this on here in just a moment. How many of you guys have had a membrane sweep, and how many of you guys are considering a membrane sweep? I'd love to hear. Tell me, tell me, tell me. Let me add this. There's that. I'm getting the right one up here. Hold on. What is happening? We've got everything going wrong. Everything is going nuts right now. All right, let me add the right one. I'm going to upload it so you can actually see what it looks like, because that's what we want to see. All right, so now we have the right graphics. Paige had one on Wednesday, and it's me. Sylvia had one with her first baby, but it was very painful. It can be. And then Candace is saying her midwife wants to do it, but I'm not sure. I'd love to chat with you guys about this. Caroline had one at 39 weeks and 2. And someone said, Kinu said she had one offered but said no. So we're going to talk about how uncomfortable it can be in just a second. So let's talk about it, right? About what it's like. So a lot of times cervical exams in general are uncomfortable when you're pregnant, which is why I'm going to end this little teaching talking about that. So a couple things that you can do to prepare yourself for a membrane sweep or a cervical exam is take your hands. Let me put myself back up here. You're going to take your fists like this and put them right under your tailbone. What that does is it lifts up your pelvic area, and your provider is able to get to your cervix easier. It just makes it a lot smoother. Another thing that I recommend is we teach some breathing techniques. We teach over 50 coping tools in Calm Labor Confident Birth course. If you are not in my birth course yet, shame on you. You should be. I'm going to put up a link that you guys can join. Let me find it. Hold on. Let's see. You guys can join today, and you can use the code. Let's see. We have several bonuses that you'll get if you join today. Let's see. Join now. Let me add the link. All right, let me show that. It's going to be down at the bottom. You can take a screenshot and join later, or you can tap it and join now. You can join the classes, and you're going to get over 50 coping tools. So the reason that I'm telling you this is during your cervical exam, it is going to be so much easier on you if you have some coping tools. And it's a great practice to gear up for your birth, because you can use the breathing, the visualization, the relaxation techniques, and the different techniques we teach you to get through your cervical exams, to get through the stress of being in the doctor or listening to your mother-in-law, whatever's stressing you out. Doesn't matter. Okay, so basically what most people say is that it is uncomfortable. But here's what I want to say to you. If you can use your hands under your bottom, use the breathing techniques we teach you, and calm and relax. So you're going to want to, let me go back to a bigger screen. Hold on. You're going to want to put your feet together, relax your knees out, and I want you to relax your jaw. Take a nice deep breath into the baby, blow it out soft and steady, slow and steady, and relax your thighs down to the bed. So if you have your fist under your behind, relaxing, feet together like you're clapping your feet, knees to the bed, you're going to feel so much better, and it will not hurt as bad. Now, someone is putting their fingers inside your lady bits, touching your cervix. It's not going to be perfectly fine. Okay. But I want you to know that you can use some coping tools to get through it. So hopefully that helps. As you can see in this picture, let me make it bigger and let me get rid of that. Hopefully you guys have joined the classes. Come on. Let me hide this though. You can also reply class. If you reply class to this live or go to the link in the notes, you'll be able to join as well. And you're going to get everything you need for this birth experience, which is why you are our birth queen. Okay, so how they do it is they take one finger, they go in, like I said, and they're going to separate that membrane so you can see and just sweep around to separate the membrane from the cervix and the uterine wall. Pretty simple. It can be uncomfortable. Some people more than, will complain, but again, use the tips that I gave you and you should be a-okay. All right, let me go back to the other presentations so you guys can see the cervical. All right. Let me go here and we're going to go and look at the cervical dilation. We're going to talk about cervical dilation. Okay, so cervical dilation. Do they need to check your cervix during labor? Anybody have a thought on that? They do not. I mean, during pregnancy, they do not. We do not recommend that our students let them check until 40 weeks unless you're being induced. That's different because we need to have a guideline of where you're at. If you get checked before 40 weeks, one of two things is going to happen. It's going to get in your head if you're not dilated. It's going to get in your head if you are dilated. If you are dilated, you're like, oh my God, labor's starting any time. And labor might not start till 42 weeks. If you're not dilated, you might be like, oh my God, labor's never going to start. And then it starts the next day. Cervical dilation before labor does not matter. It does not matter. I've had students walking around at 6 centimeters. Nope, that is not 6 centimeters. At 6 centimeters, y'all. Okay. And not in labor. So if you do not want to get your cervix checked during pregnancy, if you don't want to get it checked during labor, if you're not being induced, you don't have to. We will check it to admit you to the hospital. That's the one that's really hard to argue because we have to know if you're actually in labor. Unless you come in on your wheelchair like, ah, and baby's coming out. That's different. We're going to admit you more than likely. Although some people have a lower pain tolerance, right? So they might be coming in at 2 centimeters screaming. Fun fact, the majority of my students get to the hospital at 7 to 8 centimeters. But we've had a run of mamas this last week getting there at 9 centimeters. So you never know. And that's really because of the labor bat signal and the coping tools that we teach. We teach all sorts of movement coping tools, breathing coping tools, all the things. So you have to be prepared. So a lot of people ask me, well, what if I don't want to have a cervical exam, but I do want to have a membrane sweep? Well, unfortunately, if you want to have a membrane sweep, you have to have a cervical exam. And, the thing about the cervical exam I want you to remember is it's up to you. You should have been informed and asked. No one should ever say, I'm going to check your cervix. What I teach my students is if they do not want to have it done while pregnant, and you go to the doctor's office and they tell you to take off your clothes and put on a gown, just don't do it. You don't even have to argue. Just when the doctor comes in, if you're not gowned up, they're not going to wait for you. So that's an easy way out. All right, you guys, let me check and see if anyone has questions. I hope you enjoyed this little teaching topic all about membrane sweeps and cervical exams and your rights, because you guys have rights. Okay, let me look at my questions down here. Let's see if I have any. If you're being medically induced at 38 weeks, would they do a sweep at 37? Kat, it really depends on if you're dilated, but I would have the conversation with your provider. They might do it like 1 or 2 days before your induction. In the UK, we get offered a membrane sweep from 38 weeks. Yay, I love it. Mine starts in 2 weeks. Jenny, really? What? Jenny is a repeat offender with me. I've been with her for a couple years now, second baby. Her daughter loves me. When you join my birth classes, you guys, we meet with you guys a few times a month on Zoom. We call them our pregnancy happy hours or hangouts. And your babies will get to know my voice and Allison's voice and Ashley's voice. All right, Jade, I have GBS and had a sweep. My midwife said it's minimal. That's most providers, but there are some stinkers that say they won't do it. Let's see, how uncomfortable, painful should a membrane sweep be? Hopefully, Claire, you can use some of those techniques. And if you're one of my students, you got this, girl, you got this. Thanks for that. I've been offered it, but I said no to it. Me, I had one at 39 weeks. Let's see if I have any more questions. And Paige said she didn't find it painful at all. I had one at 39 weeks, 2 days, 1 centimeter, 60% effaced. I lost my mucus plug that night. Had baby 48 hours again. All right. That's Caroline. Good job. And Jenny said she never had one with Melly, but I was only 1 centimeter until labor. Let's see. I took your course, which is why I'm strongly considering it this time around. Yes. And if you took the birth course before, the full birth course, you get lifetime access. We have moved platforms. However, the membership, when you guys join, you get 30 days free in our membership. And it's Calm Mama Society. It's insanely valuable. It's just $19 a month. When you join our classes, you get 30 days free. You can cancel before your 30 days are up, but you shouldn't. We have expert workshops. We have a mental health coach that meets with our mamas once a month. We have postpartum hangouts for after the baby comes. We have pregnancy hangouts. We have doulas and desserts, a nighttime hangout with our doula. We have morning chat with Trish, which is you can bring your raspberry leaf tea and we'll hang out. Or if you're postpartum, we'll hang out. And we have expert workshops every single month. It is so well worth the community. And the community chat on Telegram is off the freaking chain. My girls can tell you. Make sure you guys comment class to join the classes. You get 30 days free in the membership. Do not cancel before your 30 days because you are going to love it. It's going to be your lifeline after baby. The pros and cons for getting a sweep. So, pro would be it's a natural way to it's a sort of natural way to get your body going into labor without having to have a medical induction. I don't recommend it if you're not being induced unless you're just going crazy. You could do it around 41 weeks if you wanted, but you really don't have to. It's not 100% necessary. I know a lot of my VBAC moms like to do it to feel in control. You will get checked for GBS. If you're in the US, they do it around 34 to 36 weeks. So, Journey with Leslie is saying, how far along do you recommend doing the class you offer? So, some of my students might be in here and they will tell you, sign up as soon as you find us, because most of my students are like, man, I wish I would have signed up earlier. My classes are full pregnancy, they're not just birth. And then you have access to a over 70 something workshops in the hub as a member, which you get free for 30 days. Then it's $19 a month. As a member, you also get to hang out with us on Zoom. We do live coaching. We have the experts come in. You have the whole Netflix, the birth Netflix account where you get all of our videos as well. And then you get the most powerful community of women you have ever met. When you come into us, you become a birth queen and a calm mama all at once. So we love to have you. Comment class and I'll chat with you in the DMs. I would do it sooner than 37 weeks. Yep, and Jenny said Melly loves all of us and we love her. Okay, you guys, Jenny's saying the membership is amazing. All right, you guys, I need to hop off. I love y'all. And remember, if you, you can send us a DM as well if you want. Yay, Leslie, I can't wait to get to know you. I can't wait. Okay, you guys, as you guys also know, I also coach moms who want to stay home, who want to start a business that completely changes their life using their special expertise or passion. So if you guys want to know about that, I'm doing a live over on I Am Trish Ware, which is where I coach moms who want to stay at home and have a freaking amazing business. All right, you guys have a great day. I love you, Jenny. Yeah, Jenny said she's so happy she had access her full pregnancy. The community is amazing. And we're trying to plan an in-person event in Nashville. All right. Have a great day, you guys. Let me go here. We've got